Hello there, guys, and thank you for joining me for episode number 10 of Gowing Life's Longevity Weekly, and what turns out to be our final episode of 2020. Now, it's been a turbulent year where science has been in the limelight, for better or for worse. Now, for this episode, I'm going to be bringing you just a sneak peek at our top 10 longevity innovations for 2020. This is where we've picked out the technologies, the platforms, the drugs that we think will have the biggest impact on human health and longevity. The way we've characterized this is into the number of people impacted and the years of additional life that this technology will add to each person. So, with that in mind, please sit back and enjoy. Coming in at number 10 on the list is lab automation and machine learning. Here's a short clip from Seeker just to explain what that is.
This laboratory is run by robots. These silicon scientists are executing thousands of experiments, searching for life-saving drugs, and building synthetic organisms, all with virtually no human intervention. It's part of an industry-wide push to move away from time-intensive manual benchwork and towards automation. This has the potential to transform how we develop new therapies and could fundamentally reimagine scientific discovery.
The life sciences are really underserved by automation and technology in general. If you go into a lab, you'll see humans doing a lot of labor-intensive work. There's like a joke that PhD students are kind of free labor for professors. When I was doing my PhD, that's actually when I first started using Stratios' robotic cloud lab myself. The concept was that you could log in to a web application, design an experiment with code, and then have it executed for you by robots remotely via the internet. So I got really excited, and so I signed up. I remember just sort of watching this experiment execute whilst I was just sort of relaxing. And I thought, wow, this is the future of life science.
It is clear that automation and machine learning has begun to and will continue to radically alter the way in which science and medicine is conducted. Although this field is still very much in its infancy, when attempting to work out just how many lives will be impacted by this innovation, it is very hard to argue anything other than everyone. Almost everything that we know about healthcare is because of experiments in the lab. Being able to streamline, automate, and therefore massively speed up this process will have an untold effect on the rate of innovation of not just healthcare, but all aspects of science and technology. And coming in at number 3, we have the progression of microbiome therapies. Our microbiome comprises of the populations of microorganisms that live in and on our bodies, such as on our skin or in the gut. The past 2 decades has seen a boom of research demonstrating that shifts in the microbiome bacteria populations have a causal impact on the risk of developing age-related diseases such as diabetes, cancer, cardiovascular disease, and even Alzheimer's. Now, 2020 has been the year where we have seen some of this research manifest itself onto the consumer market in the form of treatments. Pendulum, a US-based pharmaceutical company, but the first FDA-approved microbiome therapy for an age-related disease, type 2 diabetes, up on the market earlier this year. Their product, Pendulum Glucose Control, is a symbiotic that contains 5 strains of beneficial bacteria to repopulate the gut microbiota and help restore the loss of functionality of metabolizing fiber into butyrate, a molecular driver of the condition. In October, the American Gastroenterological Association released results from the largest trial to date on the effectiveness and safety of fecal microbiota transplantation. The study enrolled 259 participants receiving this treatment in 20 different clinics across the United States and found that 90% of those receiving it were cured of C. diff infection within 1 month. We estimate that these therapies will impact the lives of around 800 million individuals in the near future. This is the number of cases of type 1 and type 2 diabetes, and also chronic gut inflammation disorders. With diabetics estimated to live up to 10 years less than they would if they were healthy, these treatments have the potential to give those number of years back. These platforms will hopefully pave the way for many microbiome-based treatments that will impact an even broader selection of the population in our battle against aging and age-related diseases. Now, coming in at number 2 on our list of top 10 longevity innovations of 2020 is the launch of the Targeting Aging with Metformin trial, or TAME trial for short. We've talked about metformin on previous episodes quite a lot. So long story short, metformin is a drug that has been used to treat type 2 diabetes for the past 25 years. but has recently been shown to have a positive effect on lifespan. The TAME trial is the first human trial in that aging will be specifically targeted. Now, it'll be over the course of 6 years and involving 3,000 participants between the ages of 65 and 79 years old. These trials will investigate whether those taking metformin experience delayed development or progression of age-related chronic diseases. The impact of widespread metformin supplementation will have a two-pronged effect on the life extension of the general public. Firstly, metformin is the most widely used drug for treating type 2 diabetes, a disease which reportedly affects a third of the population of developing countries and which shortens life expectancy by 5 to 10 years. So it stands to reason that widespread taking of this drug will have the greatest impact on this part of the population. And to back this up, a fascinating study found that diabetics taking metformin actually have a higher chance of survival than their matched controls, meaning that metformin could indeed give these lost 5 to 10 years back. And secondly, metformin has also been found to possess significant anti-cancer properties, reducing the incidence of some types of cancer from 40 to 55%, a property that would impact an even wider section of the general public. As we see in this graph here, avoiding cancer can give you up to 2 years of additional life. This is why we see metformin having the potential of providing up to 12 years more life. So just some of the other technologies that have made it onto the coveted Gowing Life's top longevity innovations of 2020 include things like the increasing accuracy of epigenetic or biological clocks, the growing trend of wearable health devices, and even breakthroughs in the world of senolytics. So if you want to go and check out all that really interesting stuff and find out what's at that number one spot, then go over to the website www.goinglife.com where you can find that and all of the work that we've done this year. So that's it from me. I'm going to be clocking off until sort of mid-January. So I hope you have a great Christmas and a great New Year's, and I'll see you then. Thank you so much for watching.